HIPAA Omnibus Demystified Implications for Healthcare Providers and Business Associates. Today's presenter is Anupam Sahai, co-founder and president of eGestalt. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products, generating up to hundreds of millions of dollars annually. Prior to eGestalt, Anupam was Vice President Marketing for Ixia Inc. He's a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, networking, and is a featured speaker at several industry conferences worldwide. We want to tailor this webinar and future webinars to suit our audience. So we're going to ask a couple, actually 3 demographic questions, and they're going to be in the form of a poll. So let me launch the first question here, and you should see it on your screen now. The question is, what is your current status? And the answers are covered entity, business associate, service provider, or other. So feel free to answer one of these 4, and we'll close the poll in 5 seconds. Okay, let me close it. And our results are 44% covered entity. So the question is, what is your current status? 44% covered entity, 25% business associate, and 22% service provider. Our second question, what is your position? And the options are executive, compliance related, risk privacy related, IT related, and other. I'll give you 5 more seconds to answer. Okay, I'm closing the poll, and let's see if I can share the results here. There it is. Great. What is your position? 40% compliance related, 24% IT related, and then executive and risk privacy related. All right. Last question. Have you undergone a security risk analysis? Have you undergone a security risk analysis? Is it an easy one, yes or no? And thank you again for answering these. These help Anupam with today's webinar and also with future webinars. Okay, I'll close the poll and share the results. So 66% say yes, you have undergone a security risk analysis. Okay, good. Again, thank you for answering those polls. If you have any questions, please send them via the questions function in GoToWebinar. And if you can't find the questions function, feel free to send it in the chat area as well. I'll be monitoring both. And we'll address all questions at the end of the presentation. We have a Q&A session at the end. Now, if you'd like a copy of the presentation, please send an email directly to Anupam. His contact information will be given at the end. Anupam, thank you for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon, everybody. So in terms of the topics that I would cover today, I will start off by talking about HIPAA Omnibus and what are the changes that have been brought about by this new update to the HIPAA regulation. And then I will talk about how does it impact existing covered entities, business associates, and their subcontractors. Then I'll talk about 9 steps to prepare for an OCR audit. OCR stands for Office of Civil Rights, the organization responsible for ensuring that everybody is following the HIPAA high-tech law. And I'll provide you with some guidance on what to do in case you get summons for an OCR audit and how to put together a plan to deal with such eventuality. And at the end, I'll talk about AGFI, which is the automated tool to manage your end-to-end security and compliance issues, and how it will prepare you for dealing with HIPAA Omnibus, but also any OCR audit-related issues, and finally, concluding remarks. Before I start off, let me make some standard disclaimers. HIPAA and high-tech continues to evolve, and the information here is subject to change. While we made every effort to ensure that the information is current. We want to make sure that you rely on your legal and auditing resources to ensure it's completely accurate. So let's start off with some acronyms that we're going to be using in the presentation. And HHS stands for Department of Health and Human Services, which is the government agency for protecting health of all Americans. I talked about Office of Civil Rights, OCR. I will be using PHI and EPHI interchangeably. The only difference between the two is really whether the information is in electronic form or not. Oops. And CE stands for Covered Entity and Business Associate. So let's kind of scope out what does HIPAA High-Tech entail, what does it control, and what's the scope of HIPAA High-Tech. So while HIPAA High-Tech includes a broader set of guidance and guidelines coming from the government, what we focused today is really on a subset of the overall HIPAA framework, which is really focused around privacy, security, and high-tech related requirements. There's a whole separate set of code-related requirements which you won't talk about. And from a HIPAA High-Tech compliance point of view, we are focused on privacy and security of PHI information, which is the primary focus of the webinar today. So one of the primary objectives of HIPAA High-Tech is to protect PHI information, which stands for Protected Health Information. And everything and all the efforts required in HIPAA High-Tech are around protecting and securing the privacy and security of PHI. So PHI stands for, and it includes health information. It includes individuals' past, present, or future physical or mental health condition, or any information that can lead up to identifying an individual. It could be name, address, birth date, social security number. All of that constitutes PHI. And PHI can be in electronic form. It can be in physical form. Both the forms of information are deemed to be protected. Let me also put some scope definition of which organizations are considered to be a covered entity. A covered entity could be a healthcare provider, such as doctors, clinics, psychologists, the list there. It can also be a health plan provider, like health insurance companies, HMOs, etc. It can also be a healthcare clearinghouse, anybody that processes healthcare information or connects multiple consumers or clinics through an exchange. All of these are considered to be covered entities. So having got the definitions out of the way, let's spend some time talking about what are the changes that have been brought about by the HIPAA Omnibus rule. So if you were to describe what HIPAA Omnibus brings about in a single sentence, it's really high-tech enabling HIPAA. And high-tech was the law that was enacted in 2009, and a lot of the changes proposed in high-tech have now been incorporated into HIPAA Omnibus. And what that means is that the core HIPAA rules around privacy, security, breach notification, and enforcement, which are the sub rules under HIPAA, have changed. So what does it mean? It means that BAs, business associates, are brought into the scope of liability. So just like covered entities, business associates have now complete liability, including subcontractors. And I'll talk more about that. And they are required by law to be compliant with HIPAA High-Tech. The changes in terms of how PHI information can be used for marketing and fundraising purposes. And so there are new limitations on how the use and disclosure of PHI can be done or should be done. It also strengthens the individual's rights, the end customer's rights to receive electronic copies of the health information. And they have complete control on what information gets shared by and to what degree. So there's complete disclosure restriction that the end customers have. And this requires clearly change in the covered entity's notice of privacy practices, which is essentially the statement or the form that the end customer signs to agree or disagree about sharing of PHI information. So, and there are a number of enforcement-related rules that were provided in HITECH Act. They are now part of HIPAA Omnibus as well. And I'll elaborate on them as we go along. So there are a number of changes, as you can see. Further, I talked about the liability that now extends from covered entities to business associates and any subcontractors that they work with. So the liability scope now expands from covered entities to include BAs and subcontractors. And if there is a breach, if there is a leakage of information, either from a covered entity or a business associate or any of the subcontractors, HHS is now required to initiate an investigation when a party has exhibited willful neglect. Willful neglect essentially means that they were aware of the need to be compliant and did not take steps to remedy the situation. There is an increased penalty structure which was provided by HITECH, that has now been incorporated into HIPAA Omnibus, which means that the penalty structure, penalties have gone up severely, and now it's up to a maximum of 1.5 million per incident with no upper limit. Not to mention certain criminal prosecution capabilities that have been provided by the new HIPAA Omnibus rule. And earlier there was something called a harm threshold, which essentially enabled covered entities to not report the breach to the HHS. That restriction has been removed. And the bottom line default action if a breach happens is to notify the government, HHS, that a particular breach happened. And that's the overarching guidance from HIPAA Omnibus. So as you can see, the changes have been immense. And the scope of liability, the extent to which action needs to be taken in case of a breach, the clauses have been expanded and put in place to ensure that businesses, which includes covered entities, business associates, and the subcontractors, are following the law. They're following HIPAA HITECH rules and the HIPAA Omnibus rules, and this implementation needs to be done by September 23rd, 2013, which is a few months away. So let me expand on the requirements in the next few slides as to what are the implications of the HIPAA Omnibus rules for covered entities and business associates. And let me start off by defining who is a BA, because there's some amount of confusion there. So a BA, a business associate, is anybody who has access to PHI. And as long as they interact with a covered entity and handle PHI, they are a BA. And so examples of BAs could be accountants, lawyers, service providers, EMR, electronic medical record providers. It could be, I talked about lawyers, it could be garbage collectors, people who are responsible for handling and disposing of electronic or physical form of PHI information. Everybody is construed to be a BA. Anybody, including MSPs and hosting providers. So as you can see, there are about a pretty broad brush of people who are now constituted to be BAs, organizations that are now constituted to be BAs, and there are roughly about 2 million plus business associates that are now required to be HIPAA High-Tech compliant as per HIPAA Omnibus. So let's add some more color to the HIPAA Omnibus requirements. And let's talk about what does it mean. So let's start with privacy requirements. So as per the new law, individual rights have gone up in terms of the individual being responsible for ensuring that they restrict disclosure of PHI information to anybody who wants to use it. It allows them to restrict and limit the use and disclosure of PHI for marketing and fundraising purposes. It prohibits the sale of PHI, altogether without authorizing. Now, these are pretty severe and pretty, I would say, customer-friendly rules that now have been put in place. From a HIPAA High-Tech security rule perspective, what is required from a business perspective to be implemented are essentially a set of admin procedures, of physical safeguards, and a combination of technical security and services and mechanisms. So these are the security-related aspects or procedures or mechanisms that need, or policies that need to be put in place by the organization to ensure security of the PHI information. So remember, the whole purpose of HIPAA High-Tech, one of the key purposes of HIPAA High-Tech is to protect the privacy and security of PHI information. And there's a set of security and compliance practices, policies and procedures and practices that are put in place to achieve this purpose. And so the admin, the physical safeguards, the technical security services, and the mechanisms are putting together a set of practices and mechanisms to prevent leakage of PHI or misuse of PHI. So from a security perspective, what that means is that PHI, no matter how and where it is stored, needs to be protected. It means it needs to be protected at rest, as it is sitting on a shelf in physical files. If it is sitting in electronic version, in servers, workstations, mobile, laptops, handsets, all of those need to be protected when the data is sitting at rest, or if it is being accessed or if it's being transmitted from a covered entity to a business associate. So any form of PHI, whether at rest or in transit, needs to be protected. So if you're sending emails, if you're sharing on a Facebook any patient information, that's the absolute no-no. And so there are a number of technical protections and policy-related protections that come about to implement the security requirements that I'll talk about. So now let's jump into what should a covered entity do differently given the HIPAA Omnibus rule. So there are a number of new changes that have been brought about. The first thing is to revise the privacy policies. And this is typically done through notice of NPP, Notice of Privacy Practice to a patient. And so this revision should include the new clauses that have been brought about by HIPAA Omnibus. So one of them is to prohibit the sale of PHI without the individual agreeing to it. It requires authorization for any marketing that needs to be done or for any fundraising that needs to be done. And the patients need to be, individuals need to be able to access the electronic version of their PHI information. Whatever is being sent and transmitted online to other providers, the end user should be able to see the same information. This is, again, coming from the new requirement from HIPAA Omnibus. So all of this means amendment to the NPP, Notice for Privacy Practices, that I talked about earlier, which implements those requirements that I talked about, which gives the end user the control and the visibility to ensure that they are either authorizing or rejecting the use and disclosure of the PHI information. The covered entity also needs to amend the business associate agreements. So as I mentioned earlier, as per HIPAA Omnibus, the BAs are now required by law to follow and the HIPAA high-tech requirements. So they need to put together privacy and security related steps, mechanisms, policies to ensure PHI information is protected. So all of that needs to be put in a BA agreement, business associate agreement, which binds the business associate to follow the law and to report to covered entity. In case a breach happens in a BA, they need to now report to the covered entity that a breach happened within 60 days, which in turn would be used by the covered entity to report to the HHS. So there is now a liability chain that's extending beyond the covered entity to business associates and any subcontractors to follow the law, to provide a reporting structure, to provide a liability chain, and all of that needs to be put in the BA agreement. And of course, the security breach incident response plans now need to change because the reporting structure is that you report it to the HHS if a breach happens, either within the covered entity or in any of the business associates and subcontractors that work with the covered entity. So it needs to be reported to the HHS by default, unless a later assessment or analysis shows that it was of low harm. And there are some verbiage around what is considered to be a low harm clause. But by default, it needs to be reported, and then you can go about proving otherwise, so it reduces your liability as a covered entity. And then all of this needs requires training, communication internally to make sure that all the employees, all the workforce people who are dealing with PHI, who have access to PHI, are following the law, are not using anything, or not doing anything to cause leakage of PHI or misuse of PHI. So that's from the covered entity point of view. Let's look at the same perspective from a BA perspective or a subcontractor perspective. What does a BA or a subcontractor need to do to deal with the new HIPAA Omnibus requirements? So first thing is that they need to deal with and implement a privacy policy to ensure that they're protecting the privacy of the PHI information, they're complying with the BA agreement clauses and requirements, and they need to inform the covered entity in case a breach does happen. And they also need to provide access to electronic version of PHI to the covered entity or to the individual. Anything that's being shared by the covered entity or the business associate with anybody externally needs to be made available to the individual, to the user whose information is being shared or disclosed. And if need be, this information about who got access to the information, who used it in whatever form, needs to be made available to the end user or to the covered entity, the entity that's upstream. So if you're a subcontractor, you need to let that know to the BA or covered entity that you're working with. If you're a BA, you need to let this information be available to the covered entity that you're working with or the end user whose information is being shared. And certainly there's a training aspect that also affects the BAs and subcontractors to ensure that all of them are getting trained on the latest information. Now, BAs and subcontractors also need to ensure security of PHI information. So they need to implement all the safeguards, the privacy and security related mechanisms that are required by HIPAA high-tech, which means admin, physical, technical safeguards and mechanisms. All of those need to be implemented by the BA and subcontractor as well. And then changing the security breach response policy to ensure that BAs and subcontractors are informing the covered entity that they work with about any breach is again required as per the new laws. So to summarize, if you were to look at HIPAA high-tech, given all the HIPAA Omnibus changes, there are some significant changes that have happened. One is that BAs and subcontractors are now part of the purview or within the scope of the audits that can be done by the government, by OCR and HHS. And the fines have gone up dramatically, as I said earlier. Earlier, the fines for anywhere between $100,000 to $50,000 maximum per calendar year. Now it's up to $1.5 million per incident with new criminal liabilities, and there's no maximum fine. So if you're a small to medium practice and if you're not following the law, there's severe fines that could be levied because of any breach, potential breach, or any whistleblower clause. So there are certain whistleblower clauses that allows internal employees or any other external whistleblowers to inform the HHS, and there's some sharing of proceeds law which allows the government to recover the fines and share the proceeds with internal whistleblowers or by the enforcement agency, and they get to share the proceeds as a result of the enforcement or the fines that are levied. And the state auditor generals are now authorized and allowed, enabled by the law to bring actions on behalf of the citizens. I talked about the liability chain now extends to the BAs and subcontractors along with the covered entities. So the scope of enforcement and the fines and everything are extended to BAs and subcontractors as well. And I talked about the data breach notification requirements that have changed. So what you see here are multiple ways of penalties that have gone up to ensure enforcement of HIPAA high-tech. There is the scope of coverage issue, which includes now BAs and subcontractors. The fines have gone up dramatically with new criminal liabilities. There are civil action lawsuits that individuals can bring about if data is breached, and certainly whistleblowers, internal organization employees can also report it to HHS, thereby getting some rewards in case there are no steps taken towards HIPAA high-tech compliance. So certainly there's a lot of new requirements coming from HIPAA Omnibus. And the overall objective of HIPAA high-tech, by the way, is to ensure that the PHI information is protected. So as sharing of patient information gets more prevalent, clearly the data is exposed to external misuse, to data breaches, and all the privacy and security mechanisms are essentially ensuring that your chances of getting breached and losing patient information is minimal. So the cause is good, but it requires a number of steps to be taken by businesses as we move towards exposing the PHI information on the internet. So who's required to implement HIPAA high-tech? There are about 700,000 covered entities, and I mentioned earlier there are about 2 million plus business associates that need to be HIPAA high-tech compliant. The government also provides the federal stimulus to implement electronic medical records, which allows you to share patient information on the internet, and there are incentives for Medicare and Medicaid covered entities from the government, which kind of sweetens the pot, as it were. And to get the money, you need to show that you're HIPAA high-tech compliant, and so that helps grease the wheels, as it were, to ensure that businesses are moving towards HIPAA high-tech compliance. So the question that we often get asked is that, should we even care? Are breaches going to be affecting us? How likely is it that we get breached? And the answer is pretty scary. That if you look at the media reports and if you look at some of the incidents that have happened, both small and medium and large businesses, covered entities and business associates alike have been breached. And a lot of it is because of accidental disclosure. Some of it is because of malafide hackers who are trying to break in. And a lot of them try to break into small and medium businesses who may not have the tools and the best practices in place, because these businesses act as gateway into the bigger companies that they're trying to get into. So, if you look at the statistics from HHS, it's clearly bearing this information out. In a year, there were about 6 million records that were compromised, and various state governments have been breached, state agencies have been breached, like Utah and Alaska, and the breach tally is, 21.7 million individuals have been breached due to 600 breaches. This is like middle of March 2013, a few months ago. So, and HHS runs has a running total tally of all the breaches that have happened, and you can see roughly in a month there are about anywhere between 800 to 990 breaches that are reported to HHS, and roughly about 25% of them are actionable, which means they get penalized or fined. So this is a fairly widespread problem that affects businesses of all size. And the government maintains a list of all breaches that have happened. It's also called by few folks as the wall of shame, because it kind of names and shames every businesses that got breached. And if you look at the tally here, pretty much there's a breach reported every week or so, if not more. And that it affects covered entities, it affects business associates. There's a widespread pretty much stats across the board. And BAs are responsible for about 50% of the breaches that have happened so far. So dealing with BAs and ensuring that your BAs are complying with the law is an important step to ensure that HIPAA high-tech laws are being followed. So now, having talked about the having talked about the requirements, let me talk about what does an HIPAA audit entail. And typically, when a HHS is doing an audit, they're typically looking at certain basic guidelines to ensure that HIPAA high-tech laws are being followed. They look at privacy requirements, security rule requirements, and breach notification rule requirements. And this is basically what is required to be shown as a proof to OCR if they come knocking with asking for a proof of compliance. So what can you do as an organization to prepare for an OCR audit? So there are clearly some steps that need to be done to follow the law, to follow HIPAA Omnibus rules, to make sure that HIPAA high-tech is being followed. One is to understand what does the new law require, and to understand the requirements, and then to put together a security and compliance plan to protect PHI. As I said earlier, the security and compliance plan is to protect PHI, to make sure the privacy and security of PHI is being protected, and that sharing of information is following safe mechanisms to not compromise information. There's clearly a need to assign roles, educate and train employees about what their responsibilities are, and equip them with certain tools that allows them to understand where does the business stand today with respect to the requirements. And this includes doing a self-assessment and doing a gap analysis, which tells them the current gaps that exist that need to be plugged. Doing a vulnerability assessment is an important step, because it tells the business that there might be some vulnerabilities, some exposure that might be there because of certain IT assets that need to be plugged. And the combination of self-assessment and vulnerability management will give them essentially a set of gaps that need to be plugged. And this is the risk exposure is essentially a combination of these two activities, which will tell you the current risk report of the organization. And this needs to be done every quarter, if not every 6 months or every year. And once the risk exposure is known, there is a need to plug the gaps, put together safeguards and controls to ensure that privacy and security of PHI information is taking place. There's a need to put together a breach notification plan for whatever reason, for all the steps that you've taken. If there is a sophisticated hacker that breaks in, you want to make sure that you follow the law and report it to the HHS. And of course, if somebody breaks the law within the organization, there needs to be accountability and policies and procedures in place to let them know about what actions will be taken in case they break the law. And at the end of the day, all of this should result in a proof of compliance report, which gives the business a single-page report about the steps they have taken to ensure security and compliance related activities or steps that they have taken to protect PHI information. And this needs to be repeated on a regular basis as things change, as new employees join, as new assets are added. This process of analyzing and fixing problems needs to be repeated. And of course, this needs to be done in an automated fashion. Otherwise, it can be pretty manually intensive. So what does the OCR need to do? You need to basically provide a proof of compliance and provide a list of policies and procedure documents that you've done and steps you've taken to ensure protection and security of PHI information. Any BA agreements that you put in place or trainings that you've done, and all of this is information that the OCR would essentially review as part of their audit that they would do. And typically in an audit request, they would send out some specific requests that they would look into, but 2 to 7 is really a summary of things that they would look. And again, if you've gone through the process of ensuring HIPAA high-tech requirements are being met, then this would be part of the output of any automated tool that you would work with, or it should be part of an automated tool that you would work with. So if you were to do this manually, you can spend a lot of time, resource, and effort and still not be complete. And that's why we built the solution Agify to automate the whole process, to provide you with a one-stop solution which will save you time and money to deal with security and compliance automation. And so Agify supports, it's a completely cloud-based tool, no hardware required, and it will deal with it will provide complete compliance automation. So certainly HIPAA Omnibus is one of the compliance frameworks that it supports. It's got built-in support for vulnerability management, which allows you to assess your vulnerabilities that are present in the infrastructure, and then it will guide you to plug those gaps. The tool will also allow you to automate, end-to-end automate not just your security and compliance of covered entities, but if there are any business associates or any other vendors that they work with, the tool will allow you to have a complete view into their current security and compliance posture and the steps that they need to do to plug the gaps. And the tool comes built in with best practices, policy and procedure templates that you can either use right away or customize based on your needs to meet the requirements of HIPAA High-Tech and Omnibus and other regulations that you might be worried about. And it's cost-effective, no hardware needed, as I said earlier, and it supports the complete workflow automation that I talked about earlier. So typically, as an organization, you want to start out with doing an assessment of where do you stand today with respect to the current security and compliance needs. So you would do a security scan, you would do a gap analysis, along with risk analysis of how critical these gaps are that you're missing today. And once you have that, you would typically work towards putting together a remediation plan to plug the gaps. And that might involve putting together new policies and contracts, putting together some communication to all employees to train them. And once you establish the best practices and policy and procedure documents that are part of the tool offering, you can then go back and do a reassessment evaluation of your current security and compliance posture. And you repeat this process till you're compliant. And you want to repeat this whole workflow as often as you think is necessary. If the changes are happening very quickly, you might want to do it every quarter or every 6 months or a year. So it depends on how frequently things are changing. Clearly, security and compliance is a continuous activity. It's not a one-time activity. And so the tool will provide you with a complete real-time status of your security and compliance posture. The tool comes in multiple editions depending on the business size, depending on what your requirements are, whether you want to do a compliance assessment or a security assessment or both. You can pick and choose. And the tool scales up from very small businesses all the way to large state, tertiary hospitals or medical organizations. It's all on the cloud, and the different editions will scale up. I want to show you some screenshots from the tool so that you have a good sense of the solution. By the way, you can download a free community edition of the tool from the web as well, and I'll give you a link to that in a few slides. So when you log in, you will basically see an executive dashboard, which is the result of a security and compliance scan. And this dashboard will tell you your current security and compliance posture. In this case, it happens to be critical and very high, which means I have work to do to make sure that my assets which are of critical, which have critical exposure because of vulnerabilities that were found, and as a result, certain controls have been failed. So I need to work towards plugging the gaps so that I meet the HIPAA high-tech requirements. And you can download the community edition from egestalt.com, and this will give you a good initial snapshot of what your security and compliance posture is. In the tool, it will also provide you with self-assessment questions, which are essentially requirements that HIPAA high-tech entails. And we have taken steps to provide very simple yes and no questions for every HIPAA high-tech requirement, so that you don't need to be a HIPAA high-tech expert to understand how to meet the requirements. You can essentially use the, you can also use the knowledge base that's available to you on the right-hand side, which gives you complete guidance on how to understand the requirements, what needs to be done, and how to go about meeting the requirements. So all of that is in the knowledge base on the right-hand side. You can also upload evidence in the tool as proof that you're meeting the compliance requirements. One click brings up the policy document that is going to meet the particular requirement. You can review the requirements in the policy document. If you meet all of these requirements, you can go ahead and answer yes and attach the document. If you haven't met all the requirements from the policy document, you can figure out which ones are missing and implement those in your business. So it's as simple as that. We provide policy template documents for everything that you would need as an organization, include a business associate agreement, which is required by law. Again, you can customize this. You can leverage the knowledge base that's built in. It'll give you citation guidance. It'll give you best practices that typical businesses follow to meet the particular requirement, and it does it for every question in the questionnaire, and it gives you a risk parameter rating for every question that's in there. It'll also give you the top 10 vulnerabilities that your infrastructure has and how to fix the problem. So unlike other tools that are out there, we not only tell you what the problems are in your organization, in your IT infrastructure, we also tell you what can you do to fix the problems. So if you have software patches missing, if you have new hardware that needs to be configured properly, all of that will be pointed out by the tool, and you can use it as a task list to fix all problems that are found. And at the end of it all, you'll be able to generate a ROC, which is a report on compliance, which documents all the steps that you've taken to plug the problems that were found. And this serves as a task list. Before you plug the problems, you know what to do. And once you fix the problems, then you would know that you have a documentation of steps that you've taken to ensure HIPAA high-tech compliance. So It is a document that can be shown to the HHS as a proof of your compliance, or you can submit it to the federal government for demonstrating meaningful use to getting your federal stimulus money. I also want to show you that you can use the deliverable from the tool to monitor all the BAs and all the BAs that you work with and their compliance posture. So in this case, the number of BAs that I work with, and they have different degrees of compliance and risk exposure. So I know which BAs are more risky than the others, and I can pursue the BAs that are putting me under pressure or may cause me to be exposed to be reported to HHS. I'm a covered entity in this case. It'll give you complete details on what's compliant, how much of compliance has taken place, how many controls have checked, what's the risk exposure, and then you can use built-in letters in the tool that will allow you to work with your BAs to move them towards compliance. So it's completely, it's a complete solution, soup to nuts solution that allows you to manage not only your internal security and compliance posture and remediate all the issues, but allows you to manage any external BAs that you work with, any contractors that you work with. So if I were to summarize, if you're a covered entity or a business associate, you need to be evaluating all the HIPAA Omnibus requirements. You need to understand where do you stand today with respect to the HIPAA high-tech requirements, and then put together a plan to get towards HIPAA high-tech security and compliance. And this includes securing your PHI information, putting together a plan to deal with breach notifications if for whatever reason you get breached. So in closing, I would say certainly it seems onerous. There are lots of things, moving parts that you need to worry about, and this keeps changing. Maybe hopefully the changes will slow down to a trickle, given that HIPAA Omnibus rule has been put in place. But nevertheless, but the good news is that there are automated tools like Agify that will help you manage the whole process, simplify it, and bring it down to a few hours per assessment and remediation. And you can work with your service providers if they support Agify, or you can let us know. We can work with them or work with you to help you get you a demo of the tool. I encourage you to download a freemium version of the tool from egestalt.com. And with that, I will open it up for questions, Q&A. Mike?
Okay, great. Thank you, Anupam. Anupam, can you hear me okay? I just want to make sure my mic is all right. Okay, great.
Yes.
We'll open it up to questions right now. If you have any questions, go ahead and ask them in the questions area of GoToWebinar. We have a bunch of questions lined up here, Anupam, so I'll read them off as I receive them.
Okay.
And let me know if you need me to reread them. Some of these are long, so we might handle them offline. If that's okay, Anupam will respond to you individually by email. Do you have suggestions for the most effective and efficient way for a smaller covered entity to train employees on policies and procedures when the entity has numerous sites and locations?
Yeah, so I talked about Agify, the tool, which will also manage multi-site locations. So we can probably take it offline, but yeah, the tool will help automate and manage your multi-site locations of a small business practice. And today we have a number of small business customers with multiple site locations, so we can help you there. If you contact me separately, I can set up a demo and get the discussion going.
And on the screen right there is Anupam's email address and phone number, so feel free to contact him. Here's our next question. As a BA consultant, I perform Medicare compliance audits for home infusion pharmacy suppliers. I access systems remotely for patient medical information, medical history, and billing information. I access via their secure Citrix servers, and I have a BAA signed with every client. I am the only employee. What are my risks when accessing PHI remotely?
Yeah, so if I understand the question correctly, that you are a BA by definition, and so you need to make sure that all your processes and infrastructure is HIPAA compliant. So if you're doing that already, that's fine. Signing a BA agreement essentially holds you liable from a cover entry perspective, but you need to ensure that you're taking steps to protect PHI. So, if you're interested, we can have a conversation on what else can you do to get there if you're not doing it already.
Great. Thank you, Nupam. Next question. At the end of the presentation, At the end of the presentation, can you repeat how to get a copy of the PowerPoint? And it's been great information. So you can email Nupam at the email address on the screen. We've also recorded this webinar, and we'll put it up on eGestalt's website. And the address is right there, www.egestalt.com. Next question, Nupam. If a breach occurs because of negligence or carelessness on the part of a business associate, which party typically is penalized, the CE or the business associate?
It's a combination. Both of them are liable, and now, as per HIPAA Omnibus, both the cover entity and BA share the risk and the liability in case a breach happens. So it's a joint responsibility, and both the parties will get fined.
Okay, great.
So the cover entity has a skin in the game to ensure that every BA and subcontractor that they're working with are following the law. That's part and parcel of HIPAA Omnibus.
Okay, thank you, Nupam. If you have any questions, the attendees, if you have any questions after the webinar, feel free to contact Nupam. If you have any, if you'd just like to talk about what he covered today, feel free to contact him as well. Like I mentioned in the beginning, he's an expert in this area and can answer your questions, any questions that you may have. Now, let's see, we're running out of time, Nupam, but I'd like to, first I'd like to thank the attendees for attending today and remind them that we have recorded the webinar and it'll be available on eGestalt's website within the next day or so. Nupam, thank you for presenting today, and I'll leave the last word with you.
Well, thank you, Mike, and thank you, everybody, for coming. I know this is a very complex topic, and if you need any further information or would like to discuss your specific scenario, I'm happy to get onto a call with you and discuss it. Please note my contact information and feel free to reach out to me. I'll be happy to take it further. Thank you again for coming.
Okay, thank you, and have a great day. Bye.
Bye.